Dr. Ravikumar is a consultant orthopedic and joint replacement surgeon at Sparsh Hospital. He completed his basic orthopedic training at MS Ramaya Medical College, Bangalore, and was awarded the gold medal for securing first position in the college. Dr. Ravikumar further trained at Sparsh Hospital for the Diplomat of the National Board. He undertook his joint replacement surgery fellowship training at Sparsh Hospital and received the fellowship during this period. So thank you, Dr. Ravi Kumar, for hosting this session for our members today. And I would just like
An introduction. So I am obliged and I'm privileged to be part of this amazing meeting. So a little bit about bone health and arthritis, and at the end of the session we can take questions as well. Okay, our skeletal system is the biggest organ system, and I mean it's a structural organ system. I mean there are many organs in the body. We are worried and concerned about cardiac health, brain health, liver health, abdominal organs health, and so many health. But all these structures are protected by the great skeletal system given by the God, which is the biggest organ system, structural organ system, which is always ignored. So we cannot think of any movement or any activity without having a proper skeletal system. So I mean the 207 bones, and there is many joints in hand, wrist, and elbow, shoulder, knee, hip, and multiple versatile joint in the spine, and so on, and temporomandibular joints and facial joints, and so many joints together form the movement. That movement itself is our life. Okay, so 270 bones in childhood, they will become 206 bones. It carries around 15% of the body weight, and longest bone being femur, and the smallest bone being the stapes. And bones have around 25% of the water, 40% of the minerals, and 35% of the proteins. So to our statistics, the orthopedic problems are even more common and debilitating than any of the heart and any issues. Okay, so I'll just take this 1 minute. Yeah, sure. Okay, so and there are many bone disorders, osteogenesis imperfecta, where formation of the bone itself is wrong, and there are many classifications in that. Silence classification is type 1, type 2, type 3, and type 4. And rickets, there are many types of rickets. One is metabolic rickets, another is congenital metabolic disorder, or sometimes it may be due to blunt disease. So, and the other, this is a weakening of the bone. That is a fragile bone, the first one. Second one is weakening of the bones. Third one is a very hard bone. That's called Paget's disease. These are all metabolic bone disorders which can encounter. And next comes the arthritis. There's inflammation of the joints. It is nothing but wear and tear of a joint. It may be due to any reason. One of the reason is degeneration. Second reason is inflammation. Third is traumatic. And fourth is SLE and gout and other metabolic disorders. So, I mean, to our surprise, around 22 to 40% of the world population is suffering from arthritis, and among the entire world population, 18% is contributed by India. So, for example, we are around 140 crore population, for example. So that is not my census; it's the census of the government itself. There are more than 10 crore people who are more than 60 years of age group because of the life expectancy and so many things. So out of 10 crores, around 2 to 3 crores people are suffering from one or other kind of arthritis. So among them, at least 50 to 80 lakhs people need joint replacement surgery. They are at the terminal stage of the arthritis. Among them, only 4 to 5 lakhs people are getting operated. So such a staggering statistics. It is involving so many individuals in the country, and I mean really it needs proper attention. And these statistics are from the government website, and these crippling arthritis has disabled many people. It needs attention and proper education. So we have called gouty arthritis. It is nothing but deposition of the uric acid crystals in small joints or big joints, depending upon this thing. Rheumatoid arthritis, one more autoimmune disease. Recently, October 12th was the World Arthritis Day, and partly it is started in 1991. The slogan for this year is awareness of the and power. Knowledge is the power. Awareness about arthritis, awareness and prevention. So osteoarthritis is the most commonest. It is degeneration, usually happens due to age. So anybody more than 55 in women and more than 60 men. So we'll have some or minor or major degree of arthritis depending upon their situation, their cartilage quality, their usage, their weight, and there are so many factors contributing that. So this will lead to wear and tear of articular cartilage in a diffuse way. So then slowly they will develop pain and deformity and disability. So the many risk factors, abnormal loading, it may happen due to excessive ground level working, or I mean very high end athletes without training the proper muscular system, and obesity. So how to diagnose? When they come to the hospital, we ask them what is the problem, pain, they will have deformity or swelling. We do an X-ray and MRI if required. In some cases where there is very minimal arthritis, still they have a significant pain to rule out. Some other tests to rule out metabolic disorders. So treatment is to improve the general health, give proper exercises. Exercise will cure almost around 80% of the grade 1, grade 2 arthritis. So they will, and injections are also indicated in type 1 and type 2 arthritis, not in type 3 and type 4. Type 3 and type 4 joint replacement, obviously. Now coming back to osteoporosis, this arthritis is one segment. Many people got confused with osteoporosis and arthritis in general public. Arthritis is wear and tear of a end of a cartilage, whereas osteoporosis is weakening of the bone. So the reduced bone mass will get reduced, and the bone structure will get deteriorated, and it increases the fragility, and they will get fractured. It's like that. So, for example, the epidemiol is once again staggering, and more than 50 to 60, 65% of the more than 50 years of the population of Indians are suffering with one or other grade of osteoarthritis, osteoporosis. More than 60, around 10 to 12%. 80% among them are women, and women sustain fracture secondary to that osteoporosis, especially vertebral fracture, in around 50% of the patients. So when you calculate these statistics, so you can see breast cancer, stroke, heart attacks, and osteoporosis. Osteoporosis, staggeringly, phenomenally, many of the people are suffering. We don't notice because it is not like a heart element or a lung element or a brain element. We just ignore it, and it will cause more than death and all. It cause morbidity, like fractures, make them sit on that, then not able to move around for the long distances, and so on. So it is more of morbid disease than a. So now little more understanding about the osteoporosis. You just remember this the diagram. C is for chipping. It is osteoclast. It's the removing of the bone. B is for building. Okay. Similarly, the B is a good man. C is a bad man. So when in your childhood, the B is more, like bone building is more, bone removal is less. It's a constant phenomena. In adulthood, like for 15 years to 40 years, both are equal. Building and chipping are equal, so that the bone constantly gets remodeling and it will be in good strength. After 40 years, the bone removal will become more, chipping will become more, adding will become less. So that is called as that. That's the stage where osteoporosis will start. When equal amount of bone is removed and equal amount of bone is added, that is a normal bone. When more amount of bone is removed and less amount of bone is added, that is osteoporosis. Okay. So these are the things we should keep in our mind to understand. So as I was saying, our bone mass slowly gets peaked at the age of around 25 years, and it gets plateaued up to 40 years, and slowly it reduces from 40 to 80 years slowly. You can see, and it is even more profound in women. Okay, so it's more in women. So what are the risks for the osteoporosis? There is genetic factors. There are some medications which resolves it, some emotional stress, excessive alcohol intake, junk food, smoking, hormonal imbalance in the woman, excessive oxidation, inflammatory status, and environmental toxins. These all lead to formation of the weakening of the bone, and they will lead to the osteoporosis. So there is a very beautiful who has given a PRASC score, that's called as fracture risk score or a frisk score, whatever you can call it as. There are around 13 to 12 factors which we can add in. So age, sex, weight, height, previous fracture, parent fractured hip, current smoking, glucose corticosteroids, rheumatoid arthritis, secondary osteoporosis, alcohol more than 3 units per day, and femoral neck BMD. These all things, if we add, it will give a value. If the major osteoporotic, if the score is around 23, the major osteoporotic is around 8, so it will self-explanatory. It will give a proper scan. You can do yourself. The DEXA scan is very, very important scan to understand whether your bone is normal or it's osteopenic or osteoporotic, because the treatment differs from person to person. So who all need DEXA scan? All women who are more than 65 years, postmenopausal women with a history of fracture, other perimenopausal or postmenopausal women with the risk factors, and low body weight, less, long term on steroids, family history of osteoporotic fracture, early menopause, smoking, excessive consumption of the alcohol, and secondary osteoporosis due to parathyroid issues and other things. So these are the people need DEXA scan, and divide the DEXA scan and score them accordingly and treat them accordingly. So these are the rich calcium rich foods you can see. Green leafy vegetables, stay active, vitamin C rich foods, vitamin D rich foods to help for the calcium absorption, consume less caffeine, vitamin K rich foods to be taken, quit smoking and eat magnesium rich foods. So overall, dairy products, green leafy vegetables, and high citrus foods. Okay, this has to be encouraged in our daily meal. And also we have to strengthen train yourself, so that only bone being strong is not great. Your muscles should also be good. If the muscles are in good tone and they are acting, they will cause a proper remodeling of the bone. The remodeling of the bone will happen in such a way that equal amount of bone is taken, equal amount of bone is taken out. So the osteoporotic stage will not go. So that's why your needs. There are many drugs to treat osteoporosis. There is one anti-resorptive called to prevent the resorption. They are bisphosphonates, the raloxifene, hormone replacement therapy, denosumab. So there are bone forming drugs. They're called teriparatide, calcium, vitamin D, strontium granulate, and calcitonin and calcitriol. So, and also we should, in the elderly, any woman more than 60, any men more than 65, you have to occupy our house in such a way that we get a good railing support to stand, good lighting, so that they will not fall due to vision problem. Keep the bell or the alarm whenever they are in the necessity, they can press the bell, and anti-skid so floors has to be run, proper checkup of all the medication has to be done. So sports injuries are also common. So in them, we need diet, hydration, proper technique of treating them, rest and recovery, and appropriate to diagnose them with the proper MRI and all, then treat them accordingly. So there are some other specialities. So now this is the general bone arthritis and osteoporosis. So now the issue is not only this. So now issues are also with the scare about the surgery. When they reach stage 3 and stage 4, they need surgery. But more than economical reasons in the present Indian world, now people are worried about the what will happen after the surgery. They are very much scared. So with for them, it was due to some 5 to 10% of the people who were, even after the surgery, they were not happy. For them, the recent advances have added, especially the robotics. When you divide robot is nothing but it's a mechatronic device which can perform multiple activities by the in the surgeon's coherence. It looks like this, and it is very precise, very minimal trauma, higher safety. It has a very confident. I mean, if it as it causes very less systemic inflammatory response, less metabolism, less pain, less precision, more precision, early rehabilitation, and better outcomes and better component and alignments. So, for example, this one of the gentleman whom I did surgery. So this is how he was walking, and we did a CT scan, and we did mapping of the hip center, knee center, and the ankle center. This is how resection landmarks. This is a very staggering picture. You can see the before the surgery itself. I know what are the type of the implants I'm going to use, how I'm going to put them. So then this is the robo setup. So this is how a robo is put in the camera, and infrared cameras, and both are arranged. Intraoperatively, we put pins like this. This is how the hip rotations are done. So to match the robotic with our CT scan anatomy, once you do that, you array the align and do the GBL checkpoints and stress them to check the soft tissues. And this is how the gaps will look. And once we understand the bone anatomy, alter the implant in such a way that we create very less soft tissues. And you can see here the green haptic boundary is cutting everything. You can see in the virtual images you are seeing, I'm cutting there, but virtual images are seen here. So this is the amount of accuracy and precision we have with robotics. So, and this is how it look. You can see there, I am cutting there, the green is getting disappeared, and the bone chunk will fall off now. You can see in a minute. Okay. Yes, the bone chunk will fall off. So this is how the robot works. This is a post-operative X-ray. These all people came for suture removal at the end of 15 days without any walking support. So this is the so much difference it can get. And one of the gentlemen on the second day of the surgery, he was able to walk without any support. So, and also there is a huge demand for any compartmental replacement. This is one of our patient who had a very severe any compartmental arthritis. We did a surgery for him, and he was like this, and presently he is walking like this. He was struggling to walk. Now he's walking so well. So this is all and also it helps in hip replacement due to COVID. A lot of people are suffering with AVN because of the steroid usage or COVID itself. We don't know, a lot of youngsters are suffering. So and now with robotic, we can precisely put the implant. The same lady came for suture removal, and she also came walking without any support. So this much magical difference it can get. Now we have done 500 robotic surgeries in March. Now almost we're reaching 1,000 now by end of this year. So this is our team. By the end, I want to tell you the future is about the morphological implants. Now we have a tighter control on alignment, we have tighter control on soft tissue release, but the morphological implants has to come. We are all working on that direction. Hopefully in the future we get the proper implants. So it is always to adopt new techniques is always good for the patient. If you deny it, it is that denying meaningful solution for the patients. So this is what my chairman always tells. We always adopt new technology to help the patient in a better way and to get their proper attention so that we have all the things are taken care. So with this, I can open for any questions. Thank you. Hmm?
Uh, Thank you,
Yeah,
Dr. Ravi Kumar.
yeah,
So
yeah,
I we have some questions in the chat box.
yeah,
So I will start
yeah.
with that. So Nand Kumar, he said, is arthritis curable or reversible? And can
Yeah.
bone strength density be enhanced in senior citizens?
Yes, yes. Is arthritis, there are two different of arthritis. One is degenerative arthritis, another is post-traumatic arthritis, this different group. Another is inflammatory arthritis, like rheumatoid arthritis and other things. So these rheumatoid arthritis and all are due to inflammation happening secondary to our own autoimmune system falling against us. Definitely, these things will be not cured, that can be treated like a diabetes. You can keep the disease under control with medications, disease modifying drugs, biologics and all. Whereas degenerative arthritis, age-related arthritis, it cannot be reversed, but it can be prophylactically exercise, strengthening, weight reduction, all these things. If you do it, it will not progress. So that is one aspect of your question. Second question, bone strength and density can be enhanced with proper diet, avoiding bad habits like smoking and excessive alcohol intake, proper exercising, and taking calcium, vitamin D, and bone building like bisphosphonate drugs after proper evaluation. Definitely, the bone density can be improved with proper medications under the proper supervision of the doctors. Definitely, it can be increased. Yeah. Next question.
Oh,
I can see
yes,
a
thank you, doctor.
calcium supplement. Yeah.
Yes, so calcium supplements are usually recommended for women. There is a view that calcium supplements cause calcification in the arteries. What is
No,
the
no,
right
no,
thing
no,
to
no.
do?
It won't cause calcification. Will not calcium will not cause calcification in the arteries. And I mean, if you give proper recommended dose like 500 mg to 1000 mg, depending upon the deficiency, definitely it will not cause any side effects like calcification of the arteries. It won't cause.
All right. I hope, Sunita, this has answered your question. Next, we have a question from Pushpa. I had
Hmm.
a TKR on my left knee 2 years back. How do I
Hmm.
safeguard my operated knee and it prolonged its life?
Yeah, first and foremost, she should not weight gain. I mean, gaining of weight she should not happen. She has to keep her weight under control. Second point, she should not sit on the ground and avoid Indian toilets, something like a deep squatting and sitting on the ground, so that wear and tear of the poly will not happen. Third, she has to brisk walk and keep her life active. Fourth, her quadricep muscles and hip abductors has to be strengthened periodically so that the muscles are loaded more than the implants. Fifth, as soon as she gets any infection like ENT, nose, ear, eyes, dental, immediately she has to show to the concerned person and get it treated. These are the five things she has to do.
All right. Thank you, doctor. Another question from Nand. What is the
Yeah.
success rate of knee or hip replacement
Yeah,
procedures?
if the right surgery is done, like a knee or hip replacement done for a right patient by a right doctor in a right place, right hospital, if all these things are right and with a good physiotherapy, right person, they'll all 4 hours, like everything should be right, then it should survive for 22.5 years, ideally. It also depends upon multiple factors, their usage after the surgery, their bone quality, and there any cross infections, anything like that. But overall, if everything goes well, it should survive for 22.5 years. For in patients, at least 90% of the patient, 15 years in 99.8% patients.
All right. Thank you so much, Doctor. Next question is from Dr. Sushila.
Yeah, yeah.
She's asking, what is morphological
Yeah.
implants?
Morphology of the knee is not understood well as of now. So we only know we have some implants as of now, like we have single radii, multi radii, and all. So the like bone matched implants has to come. Like the profile and the anterior part should be thin, posterior short should be thick, and the thickness of the implant distally. So and also it should match the anatomy of the patient. Those morphology of the knee has to be understood even more better. Now we have understood around 89 to 90%. Another 10%, the study should go on that. And when you create a proper morphological implants, plus there is a proper robotic supplies to check the technical aspects, to understand the kinematic alignment, other things, plus proper execution of the surgery. This may increase the satisfaction rate up to 99%.
All right. Thank you. Next question is from Jayashree. Can
Yeah.
you talk about RA? Any suggestions to reverse or cure it?
Can you talk about RA? Yeah, rheumatoid arthritis is a autoimmune disorder. It fails to recognize our own tissues and act on it. Especially, it affects the small joints of the hand and small joints of the foot. Sometimes it may affect the major joint like the knee and the hip. So it is very, very common, commonly encountered in the women, especially because of the immunological alterations. So when it happens, if it affects the major joint, so we have to first clinically evaluate them and check the rheumatoid factor, anti-CCP bodies, and ASR and CRP. If R are elevated, so we have to start on disease-modifying drugs and sometimes steroids if the disease is very active, control the disease and they keep the disease under control. If the disease is under control, it will not cause damage to the cartilage. Otherwise, our own synovial tissue will create tumor necrosis factors and alpha factors, and which will start eating our cartilage and cause arthritis. So as much as possible, it's not like we cannot cure it, we cannot reverse it, we can only control it.
All right.
Is there any
Thank
solution
you,
for
Doctor.
plantar fasciitis? Yeah.
Yes.
Okay. Yeah, definitely plantar fasciitis is a treatable condition. Most of the time it is self-limiting. Within 3 to 6 months, it will go away on its own. But sometimes it keeps bothering for some people for years. So for them, we start with them soft chappers like MCR slippers, ankle stretching exercises. The tendo actually should be lengthened. And also intrinsic foot muscle exercise, some ointment, some ultrasound massage, and all those things. So we try that for 1 month. If it is not working, we can identify the plantar fasciitis point and we can give some injections. It may be PRPP, it may be steroid. One or two dosages can be given. So most of the time with exercise, in my practice with exercise, around 90% of the people will with physio and good chapels and slippers and soles, it should get cured.
All right. Thank you. Next question is from PN Murthy. How do we get magnesium? Does the sprays help?
Does the space help? Yeah, yeah. I mean, to be honest, uh, magnesium, the dietary thing is enough because it has very minimal role in metabolism of the bone. So yeah, obviously there are a lot of fancy things. Bone, I mean, sprays can help.
Okay. Then we have a question from Professor Maggie. Can those 80 or 90 years do hip or knee replacement?
Yeah, just today I did knee replacement for 84-year-old gentleman. So it depends. It's not the age. It's not the chronological age. It's the physiological age. So we have to evaluate them, both cardiac, physical fitness, and also there are four parts in that. First is how are their blood parameters. Second is how is their cardiac health. Third, how is their comorbid controls. Like for example, if they have hypertension, whether it is controlled or not. If they have thyroid, it is controlled or not. If there is a diabetes, it is controlled or not. Then anesthetist will see and quantify the risk stratification. If all the risk stratification is under ASA grade 2, we can definitely go ahead and do surgery. Many people, more than 500 people, more than 80, I have done surgery, but more than 90, I think I would have done around 25 people. That's it. So with them, if you properly risk stratify, you can do surgery. But for example, some people are 65, but they are very comorbid, like their heart condition is not good, their lung condition is not good. For them, we can't do surgery. So like that, age is not is a factor. Here, her endurance, her general health, and their bone quality. So these three things counts more than the age.
All right. We have another question from Yasmin. She thinks calcium supplements give her severe calf pain.
Calcium supplements? No,
She
no,
mentions
no.
that.
No. Calcium supplements won't give severe calf pain. Sometimes some calcium, commercially available calcium, they are they are little allergic, like they will get gastritis and other things, but nobody will get calf pain. In my practice, I have never seen anybody having calf pain. Calf may be due to different reasons. They may be having spinal cord issues. They may be having claudication pain. They may be having L-carnitine deficiency, or they may be having DVT, they may be having varicose veins. So all those things has to be taken care rather than calcium will causing the coffin. Yeah.
All right. Another question from Sunita. Is
Yeah.
magnesium supplement along with calcium and vitamin D required? Any
Mm.
other supplements that you recommend?
Yeah, again. So three things. One is calcium, another is vitamin D to help it's for absorption. Another is vitamin B12 is very, very deficient in many of the people. So vitamin B12 deficiency, that will be good, B12 supplement. And magnesium and all, some people will take some. I don't recommend all those things. Proper good diet with, because whichever is not available in the food, like calcium requirement cannot be satisfied with the food after some age because the bone resorption will be more. Vitamin D in the food is available very minimal in especially cod liver oil, something like that. So which we cannot once again met the need. And also if at all you want to get a vitamin D, you have to go and stand in the sun from 11 to 1 o'clock, which is a little difficult. So that's why I generally supplement vitamin D, calcium, and B12. So other supplements I generally don't do.
All right. So, doctor, I would just like to ask you another question because there's a mention of supplements. How do you know which supplement is good? Because there's so much of variety in the market.
Yeah, I mean, so this no, that ideally you have to you have to quantify. I mean, you have to evaluate the deficiencies by checking magnesium, calcium, vitamin D, and then treat them rather than blanketly giving all the supplements for everyone. Also, is not correct. Sometimes the toxicity
Hmm.
itself is not correct. So, calcium supplementation in a minimal dose of 500 mg is okay provided they don't have any symptoms. If they have symptoms, you should quantify the deficiency and correct them. That's one part. So we should not blanketly give every supplements for everyone is what our orthopedic book suggests.
All right. Thank
Can
you
I
so much.
play tennis after take care? Yeah, impactful sports better to avoid because the polyethylene will go for wear and tear. Yeah. So yeah.
Yes.
Any cure
Next
for
question
flat
from
foot in a senior citizen?
Flatfoot for senior citizens. Yes.
Yeah, so that is no surgery. Just they need medial arch support, proper medial arch support, and you should check what is the status of the flat foot. Is it a flexible flat foot, or is it a just correctable arch is collapsing, or is it any compounded with ankle problem? We have to check that. Like ideally, flat foot means it will not come alone with a flat foot at the age of 65, 70. It could have also with other ankle problems and all. We have to quantify them accordingly. We have to treat. If they have an ankle plus flat foot, we need a medial arch support plus ankle stability shoes. If they have only flat foot, they need medial support. If they have minimal flat foot, exercise will enough. Like that. It depends on the type what they are in. So, ma'am,
To unmute yourself and ask this question.
can I?
Daisy, can you hear me? Okay, I think a question means if an osteoarthritic person can the person escape surgery if the knee condition
Yeah.
is good by
I read
walking?
this. Can I ask you?
Sure. So we have a question by Yasmin. Steroid injections for the heel give only temporary relief. Even
Yes.
wear gel-based shoes, but pain persists.
Okay. See, basically knee arthritis is a wear and tear of the knee.
Just like your tire of a car goes into wear and tear. The more we use the car, the tires will go into wear and tear. Just by applying some grease or anything on the tire will not fix the nature of the tire. So in knee, the cartilage is worn out. Giving steroid injection or giving some any hyaluronic acid or anything will not help in regeneration of the cartilage. It will just help in the postponement, immediate postponement of the surgery. That's it. So it's not a permanent solution. It's just an solution to just postpone the surgery for 1 or 2 months. That's it. So steroid as such will not help. And
All right.
repeated
Thank
steroids is has its own disadvantages. The steroids will decrease the immunity of the body and will sometimes accelerate the wear and tear of your cartilage. So once
all
the
right.
patient gets steroid injection, they will feel some pain relief. So they start doing more and more of non-advisable activities like climbing stairs, roaming around too much, sitting cross-legged. So this will cause accelerated wear and tear of the cartilage. So from our point of view, we don't recommend steroids for patients. Only if it's an emergency, patient has some immediate work to be done in the coming days, like some family function is there or some other health issues are there. They want to postpone the surgery for 1 or 2 months. Only then we'll advise them steroids or any other gel-like injection to the knee, or else we usually don't recommend.
All right. Thank you, doctor, for that question. Next, we have
Yeah.
another one from Mr. Nagaraj Rao.
Yeah.
Does vascular history like ulcer go through TKR?
Does vascular like ulcer go to SSC? Any surgery, for example, any lower limb surgery, the vascular competence of the limb should be proper. That means the blood flow to the limb should be proper. So we are operating on a leg where the blood flow is not good. For example, any uncontrolled diabetic patient, diabetes from almost on 15-20 years, their vascular condition will not be so good. So if we operate in such patient, the wound will not heal well because the blood circulation is not good. So the recovery will not be so good. So vascular history is very important. So we have to rule out any peripheral vascular diseases. So if the patient is a chronic smoker or a chronic tobacco chewer, so we have to make sure that the blood circulation in his lower limb is proper. So if he has any history of any DVT, any blockage of the lower limb arteries or vein, so we have to rule out, get one angiogram done, lower limb scanning they will do. That will tell us whether the blood flow is normal in the lower limb or no. Only if the blood flow is normal, we have to put a knife on the knee, or else we should never operate. Is
All
it
right.
clear?
Uh, yes.
Yeah.
Next question, Dr. from Margi. Is dietary calcium enough if there is no health issue in senior years?
No, no, no. Dietary calcium is not just enough. Just by giving calcium, your bone health will not improve. Or else then they would have given calcium in every places. In temple, if you go, instead of prasadam, we could have given calcium tablet to elderly people. Okay, so calcium is not a solution for bone health. Calcium is a supplement. Bone is a dynamic structure. You should understand that. Bone is not like just like if you think our skeletal system is a building. Building you construct once and leave it there. You won't do any other modification, nothing. It will stay for 20 years and it will follow. But our human body is not like that. Every day, 1 or 2 bricks will be taken out, 1 or 2 new bricks will be added. Okay. So calcium is like a brick. The more you use your body feels that I have to become stronger. It will use the calcium and become stronger. Only if you're eating calcium and not using your body, the body will feel that I don't need calcium and it will not use the calcium. Whatever calcium you take by your mouth, it will just come out of your stools and all. So it's a dynamic method. The bone should feel hunger. Only when the kid is hungry, it will have food. So with exercise, regular exercise and some physical activity, your bone will feel hungry. Only then when you take calcium, it will go into the bone and your bone will become stronger. So just giving calcium supplements is not fine. Then if that was the solution for osteoporosis, it was very easy to treat osteoporosis then. Right?
All right. Next question is from Kanchana. Do
Yeah.
you recommend K2 MK7 along with D3 supplement? And if yes, how much MCG to be taken?
Okay, okay. All these things are supplements. There's like there is one regular varies from person to person. What the person is, how is his lifestyle? Is a person a normal healthy person, or is a person is a diabetic patient, or is a cancer survivor? All these things are taken into account when we recommend any doses for any nutrition supplements. I feel is if the person is a normal healthy person, he should just have his normal a daily diet, like what regular food we prepare in your home. It should have some amount of carbohydrates, some amount of protein, some amount of vegetables and fruit. That's more than enough. No need to take all these supplements. It's all just marketing thing, what a pharmacy company do. They add so many things. Some will say we'll give only calcium. Other will say we'll add vitamin D with calcium. Some will say with vitamin D we'll add some other thing like micronutrition and all. All those things never work. The food is the best medicine you can have. And the absorption of nutrition from the food is even more greater compared to a tablet or anything. So just by taking tablet will not improve your deficiencies.
All
I
right.
have seen people who take
Next,
too much of calcium tablets without any recommendation. They end up in kidney stones. Usually in summertime, when there's too much of heat and all, they don't drink water, but they continue taking calcium tablets. That will lead into kidney stones or calcium deposits in their glands. Parotid glands may have calcium deposits. Pancreas may have calcium deposits. All these side effects of excessive calcium can occur. So better to get your serum levels done. So there are blood tests which will show how much is your vitamin D, how much is your calcium, how much is your other micronutrition. If there's only deficiencies there, it's better to take a supplement for a certain duration, not for a very prolonged duration. Supplement should not become like your daily food. They should be taken for some 1 or 2 months and then they should be stopped.
all right. Thank you, doctor.
Yeah.
Next
Yeah.
question from Pushpa. Do you recommend regular spine X-ray for over 65 years old? I get a mild back pain when I strain a bit, which goes with time.
Yeah, see, back pain is a very common issue. Even I will be getting back pain. So there are various types of back pain. One is mechanical back pain. Mechanical back pain is that your back just become tired, like you're making it to work more than what strength it has. Then it will become tired and it will cause pain. For example, if I have the capacity to lift 20 kg, but I start lifting 30 kg, my back muscles will become sprained or they become tired and they will cause pain. So such pain will go off with some rest. The next type of back pain is any neurological. Along with some muscle sprain, there is some nerve compression. Okay, that has to be noticed very seriously and taken immediate. Any medical advices should be taken. So regular spine X-ray is not recommended. So only if you have like back pain without any exercise, you are getting back pain or resting pain is there. Even if you take rest, the back pain is not going. And there are multiple bony aches are there. Sometimes in elderly patients, males and female above 60 years, the risk of cancers increases. Not just back cancer, any parotid cancer, any prostate cancer, breast cancer, ovarian cancer. The most common site where the secondaries can go is the spine. So in elderly patient, back pain, weight loss, any other abnormal thing, bowel and bladder is not proper, difficulty in passing stools, or any lump in the body. If these are there along with back pain, then you have to definitely go for a low back screening. So X-ray will just give you a brief idea about the bone anatomy. So better investigation is MRI. So better investigation.
All right.
Clear?
Uh, yes. Thank you, doctor. Next is from
Yeah.
Shaila. There is a lot of confusion about vitamin D,
Hmm.
whether it gets absorbed in body without any carrier. Some say it should be taken with calcium. Some say it is not required in all cases. How to take vitamin D?
Okay, okay. Like I told you, calcium is like a brick for a building. Vitamin D is a construction worker. Okay. Vitamin D acts like a construction worker. So vitamin D, what it does, it takes the calcium from your blood, put into your bone. That's the work of vitamin D. Okay. And there are other functions of vitamin D. It maintains your skin health, keeps you active, you won't feel laziness. All those are the extra things. So it's a balance of things. So the question is like, what exactly the question? Vitamin D, how much we have to take?
Whether it can get absorbed in the body without
Yeah,
any
yeah,
carrier.
exactly.
Some say it
And
should be taken
vitamin
with
D,
calcium.
yeah, yeah, vitamin D is a fat soluble vitamin D. Okay, there are four vitamins with a fat soluble. A, D, E, vitamin E, vitamin D, and vitamin E. These are fat soluble. So that's why we see that the vitamin D is rich in milk products like butter, ghee, and paneer. All these milk products will have a lot of vitamin D. So it doesn't need any carrier. It usually get absorbed. Any fat soluble food, it get absorbed. So nothing to worry. Once it get absorbed, even in our body, it's attached to our fat.
Okay.
Hmm.
Okay.
All right.
Yeah.
Anything else?
Next question we have from Meena Shah. Person who has osteoarthritis should avoid what type of food?
Nothing. There's different type of arthritis. One is mechanical arthritis. That start after some 50, 60 years. You walked a lot, you used your body went into wear and tear. That's normal. Okay. For that, there is no special food. It's a mechanical problem. Just like wear and tear of the car tire. So if there's a mechanical problem, you have to solve it mechanically. Other type of arthritis is rheumatological, inflammatory. That is your own body is attacking your cartilage and causing arthritis. That has different type of medicines. There is no any specific food that has to be avoided to prevent arthritis. Only thing you have to avoid is smoking and alcohol. That will decrease the blood supply to your bone and will cause early arthritis. Regular food what we have in our home doesn't affect our arthritis.
All right. We have a question from Nagaraj. He says, can I play tennis after knee replacement?
Can I play tennis after knee replacement? See, the most common cause for unsatisfaction after a total knee replacement is preoperative over expectations. Some patients will come with too much of expectation, like I want to do that, I want to do this. Is it possible after knee replacement? It's not like that. See, you have to see how well is bone health is, how well is muscle health is. Yeah, you can play tennis after T care, but within certain limits. Previously, you used to play some 2 hours per day. Now you have to just decrease it for some 15, 20 minutes. Whatever we are putting inside is an artificial thing. Just like your normal bone, even this thing will go into wear and tear. The more you use it, the more it will go into wear and tear. So, like we said, if sir told that there are four rights, if a right surgeon, right patient, right hospital, right physiotherapy, there's a surgery, the survival rate is around 20 to 25 years old if everything is right. So that we have to maintain it. If we do too much of physical thing and like jumping and all, trekking and all, running and all, playing tennis and all, the inside thing will go into wear and tear. So if we are operating in a very young patient, like 50-year patient, when the knee replacement started playing vigorous physical activity, tennis and all, so they will end up in revision surgery at 70 years. So it's a balanced thing. We can't say complete like you are not supposed to do this, you are not supposed to do that. It's a balance between both. You should take care of your knee at the same time you should play also. So somewhere in between there's a thin line you have to manage it. I can't just say you are supposed to play or not supposed to play. It's not like that. You can play, but limited playing, like 15 20 minutes per day is fine. Fine. Am I clear,
Any,
Nagraj Rao?
Yeah.
yes.
Yeah, you can play
Anybody has
anything
any
you
other
want,
question?
but within some limits. That's all.
Okay.
All right.
Yes, doctor, thank
Uh,
you.
Yeah.
all right. Anyone have
Thank
any
you,
questions?
doctor.
This is your last chance to put it in the chat box.
The only take-home message I want to give all you elderly people is that don't worry too much about your knee. Don't worry too much about arthritis. Don't worry too much about your bone health, calcium. Don't worry too much. Just remember that be happy, eat your regular food, whatever you prepare in home, have it properly. Some 20 or 30 minutes of simple exercise, brisk walking or whatever. Okay. Think about knee replacement only when you think that your knee pain is disturbing your day-to-day life. Like you are not able to go to temple. You are not going to able to play with your grandchildren. You are not able to attend any family functions. Something like I want to do this, but I'm not able to do this because of the knee pain. Only when you reach that stage, think of knee replacement. And next advice is don't take unnecessary treatments like knee injections and all. Okay, putting some gel inside your knee or some Ayurveda treatment or something and all. Don't believe all those things. Okay, it's a simple mechanical problem needs a mechanical solution. That's all. Okay, don't worry about it. So if it's affecting your day-to-day activity, if it's the pain is affecting you psychologically, only then you are eligible for knee replacement. Just because someone is getting knee replacement at 60 years doesn't mean that even you should get knee replacement by 60 years. I've seen so many patients who have very severe arthritis, but they're comfortable, they're happy. They're able to take care of themselves. They're able to go to temple, go to marriages, attend family functions. They're happy. They have some amount of arthritis, but they're happy. Such patient doesn't even need any knee replacement. Only when you're finding that it's difficult to enjoy your life, that's the time to get a knee replacement. And also, you should not postpone it to a certain like like you know that now you are 60, 65, you have knee pain, then better to go with replacement. Don't wait till 80, 85 years and all. Okay, and like we told you, the survivability of our implant is around 20 to 25 years. So plan accordingly. Your age should be good. Okay, so around 60 to 70-year old age will be good. So surgery outcome will be good. So you'll be able to enjoy your life from 70 to 90 years. After 90 years, we'll see what happens. That's nothing to.
Yes, thank you so much, everyone.
Yeah.
Thank you.
Thank you, doctor. Yeah, thank you.
Thank you. Thank you.
Thank you.